So I'd like to briefly also talk about some policies that underlie recognizing the lived experience value. So the first one I'll mention is, and I'd like to say there are many, but I'll only briefly talk about 3, but there are many frameworks. So the first one I'll talk about is the UNCRPD. There are also many, the WHO Mental Health Action Plan, the WHO Quality Rights Initiative, the WHO Guidance on Community Mental Health Services, Lancet Commission on Ending Stigma and Discrimination in Mental Health. All these talk about the value of engaging people with lived experience. So in the UN CRPD, a key principle of human rights-based approach is people's right to participate in decisions that affect their lives. I think that's pretty straightforward. If it affects me, I need to have a say in it. So we insist people with lived experience need to be meaningfully engaged in research and in various other sectors. It also calls for full participation and meaningful engagement of people with mental health conditions, and I'll briefly talk in a bit talk about that meaningful engagement. So we say people with psychosocial disabilities. When we talk about the UNCRPD, of course, we're talking about the rights of persons with disabilities. For some people, they struggle to see mental health conditions as a disability, but many do recognize that there are psychosocial disabilities. And this involves actual or perceived impairment due to the diversity of emotional or cognitive experiences. So while there are a lot of information and a lot of devices for people with physical disabilities, there is room to see what kind of devices or technologies can assist somebody with a psychosocial disability. So, for example, is it noise blocking earphones? Could I get a subsidy if I need noise blocking earphones for my schizophrenia? If it helps me not hear voices, can that be? Can I get access to that even if I don't have the resources to get it for myself? The same way somebody with a hearing impairment gets a hearing aid. So there are the researches that can be done. There's a few that have been done on assistive devices, and maybe there could be some done for our context, or what kind of devices could help people with psychosocial disabilities. Then when it comes to the public stigma that relates to mental health conditions, there are these negative stereotypes that sometimes could prevent people from engaging even in these researches. So somebody, maybe a lot of people assume that somebody, yes, they would want to involve somebody with a lived experience, but they question whether they have the insight, whether they are capable of meaningfully engaging. And I want to insist, yes, we are capable of meaningfully engaging, because symptoms tend to be temporary and they are treatable. So the fact that I have schizophrenia doesn't mean I'm absolutely unable to, maybe not when I'm having my symptoms, but again, my colleagues will cover that. But we need to recognize that people do have the ability and the capacity to meaningfully engage, as the UNCRPD calls for. Of course, people will avoid engaging where situations will expose them to more discrimination. So we need also to be careful in how we engage, not to disempower those we engage. There's also the United Nations, the SDGs.
Sorry, Rosemary, I think we are losing you.
They emphasize the need for inclusive mental health policies and services that recognize the
Hi, Rosemary. I think we lost your presentation. Let's give her some moment to connect again. I think she's having some problem.
Hello.
Yes, now we can. Sorry, we can still hear you, Charity. I mean, Rosemary. Welcome, Charity. I think we lost Rosemary for a moment.
I'll request
Yes,
Edin. I think the network is.
yes,
Yes,
welcome back,
sorry.
Rosemary. Now we can hear you. Sorry, we lost you at some point.
Maybe if you could let me know how far back did I drop off? Had I talked about the SDGs?
It's the SDGs.
Okay. I was just about to conclude my bit of introduction. So I had just mentioned about the SDGs, and they too call for the engagement of the perspectives of people with lived experience. And finally, I wanted to share something. I'll quote it from the framework, WHO framework for meaningful engagement of people with non-communicable diseases and mental health and neurological conditions. And it talks of meaningful engagement as respectful, dignified, and equitable inclusion of individuals with lived experience. And it mentions that this should be done across a range of processes, activities, within an enabling environment where power is transferred to people. And it also refers to valuing lived experience as a form of expertise and applying it to improve health outcomes. My colleagues will talk